Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marianne Crowe, your resource for COVID-19 related news and information. Send us your questions to fnhma@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tanse from the Nation Talk offices in Toronto, home of the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, and many diverse nations. We wanted to make sure we've got that land acknowledgement in. I am Marianne Crowe. It's an absolute delight to be bringing reliable, credible information on COVID-19. And thank you so much for welcoming us into your territories, your nations, your organizations. We have been delivering 48 hours of COVID-19 information since last March. This is our second last town hall. So make sure you tell all your aunties, your cousins, all of our kinship that they definitely don't want to miss next week, Wednesday, June 30th, for the last COVID-19 information session from the First Nations Health Managers Association, and I'll talk a little bit about what to expect. So thank you again to all of our Indigenous media partners who are creating an opportunity for us to share this information via the IH Today website, APTN, all the Facebook pages, and to all of you broadcasting this on the radio stations as well. We thank you so much for coming together to make sure we get this information out. My name's Marianne Crowe. I'm the Chief Executive Officer. I come from Pipot First Nation in Saskatchewan. Yay! Hello, Saskatchewan and the rest of Turtle Island, but I am a Pipot princess, proud to be from Treaty 4 territory, and I personally now live in the unceded and unsurrendered territory of the Algonquin people in Ottawa. I do want to do one more land acknowledgement. Thank you to the Mohawks of Akwesasne for letting us govern our organization in your territory. We spread out, our family is made of multiple different nations, and a big thank you to the FNHMA Board of Directors who provide this strategic vision for us, and to the family working all from home remotely. I thank you for your dedication, your commitment, and for ensuring that we are continuing to help with keeping nations secure in terms of their fight against COVID-19. We have two guests today on the second last town hall. We're definitely going to welcome to our FNHMA town hall our partners at Indigenous Services Canada. Mark will be joining us shortly. And we also have the Indigenous Primary Care Council coming in as well. And Nicole is going to come into the crow's nest in a little bit as well. So if you have a question, and hey, if you want to give a shout out to one of your hardworking healthcare workers, your health director, your health manager, that nurse in charge, anyone who is involved in this campaign, please feel free to send that shout out to fnhma@ihtoday.ca. And if you have a question for one of our guests, please send that through as well. We'd be delighted to get that question answered on air. And I will do my shout out to Auntie Judy Sugar, Certified First Nation Health Manager of the Pie Pot Health Services. Hi, Auntie Judy. Thank you for working so hard at home, making sure that all of our members are safe. So thank you so much. Now, without further hesitation, let's bring in our first guest. Mark Sagan from Indigenous Services Canada joining us from Winnipeg. I'm not even going to say anything about the Banjo Bowl, Mark. Come on into the crow's nest. Welcome.
Thank you, Marianne. And again, I will remind you that Winnipeg is currently the defending Grey Cup champion, so good luck. Thank you very much for having me on your show today, Marianne. I'm in my current role, I'm joining today from Winnipeg, Manitoba, Treaty 1 territory, birthplace of the Manitoba Métis Nation, and home to many Inuit as well. I'm currently serving as the COVID-19 liaison between Indigenous Services Canada and the Public Health Agency of Canada, helping with the rollout of vaccine to Indigenous people across Canada. I work very closely with Dr. Tom Wong, and Dr. Evan Adams, Kim Daly, Jocelyn Formsna, and many other colleagues from FAC and from across the country as well. I'm in the unique and I think very privileged and humbling role of being involved with meetings and issues and vaccine supplies and fridges and planning and problem solving from coast to coast. And I'm just so incredibly humbled to see some of the work being done in so many Indigenous communities, as well as in urban or Indigenous organizations. People really are working so hard to make sure vaccine gets to wherever it needs to be in this country, to make sure it's available to anyone who wants it, really being encouraging and positive and respectful about how they receive the vaccine. And it's just amazing, what can be done. And to be allowed to be a part of this is very, very humbling and very rewarding. Just so many people doing so much. I also want to thank you, Marianne, for inviting me on the town hall today. Having had the pleasure of working with you at FINIM many years ago on e-health or digital health technologies. Your energy, enthusiasm, and positive spirit was always a pleasure to be around. You were also good at keeping us humble with a well-placed comment when we needed it. And you demonstrated then, as you do now, great passion and caring for Indigenous people. So again, it's great to connect again and an honor to be on your show. Just want to start with giving a very quick update on just some of the vaccination numbers in First Nation and Inuit communities across the country. Over 588,000, well, let's just round up to 589,000 doses administered, first or second doses to ages 12 and older. And of those, 227,408 are second doses ages 12 and older. And these numbers are constantly rising. So just amazing work again, Indigenous communities to ensure that the people are getting vaccinated. It really is making a difference. That being said, it's so important to keep in mind that there are variants out there. COVID is still around. Being vaccinated helps, but especially with 2 doses, but really one needs to keep up those public health measures to keep others safe, and especially for those who aren't able to be vaccinated, such as children. So please keep up the excellent work everyone is doing, and we will get through this together. I was asked to speak on an emerging issue that's coming up for all Canadians, and what this might mean for Indigenous individuals in Canada. You might have heard about, sorry, I just got momentarily distracted by Marianne just sent me a little happy face. Thank you, Marianne. But I will try to be focused on my presentation. As you can see, I don't have a lot of experience with media, but hopefully I'm doing not too badly. So proof of vaccine credentials, you might have heard about vaccine passports or vaccine certificates. Basically what this has to do, this work is being led by the Public Health Agency of Canada and Immigration, Refugees and Citizenship Canada, or IRCC, on this. I think the most important message first is that non-essential international travel really is not encouraged at this time. There's a lot of COVID still out in the world, and I think people, although we all do want to get back to being able to travel, seeing family and friends, seeing the world, it's just not a good idea yet. Let's keep working on getting COVID under control. But that being said, it is important to start the planning now for when international travel might resume. Other countries, the European Union, Australia, are already making plans for having a verifiable, authenticated system for travelers to be able to present what vaccinations they have received so they can determine what entry requirements might apply. So for example, we might be exempted from quarantine or isolation. So Canada wants to have a system in place so Canadians can demonstrate their vaccination status going to other countries, but also for returning Canadians to be able to show their vaccination status upon return. At present, the federal mandate is around international travel only, basically the role of, again, protecting our borders and ensuring the safety of Canadian citizens. Now, certainly some provinces and territories might decide to implement their own use of vaccine credentials for public health reasons. So for example, the territories, Yukon has implemented that they're waiving an isolation requirement for people who can prove they've had their 2 doses of vaccine plus 14 days after vaccination, indicating they're fully vaccinated. Here in Manitoba, people who are fully vaccinated can now visit relatives in nursing homes or palliative care more easily because they're less likely to present a risk to the residents. It's been recognized that the final system, when implemented, it is all still in the design stages, needs to have both digital options for those who want to carry their proof of vaccination on their smartphone, as well as a paper option. The paper option, basically, then you might have to have another form of ID to sort of verify the name on the piece of paper is the same as the person who's presenting in front of them. So a photo ID like a driver's license. The key thing to remember is that a vaccine credential, it's not a permission card. It doesn't say what you can or can't do. It is just a factual statement of these are the vaccines I've received on this date. And then it allows, for example, you're traveling to other countries, then to apply their own rules or guidelines around what they consider to be valid vaccines. But again, the key thing though is that again, it's a record. It's not a permission card. Now, because this does have implications for Indigenous communities as well, because we want to ensure that Indigenous considerations are taken into mind in planning for this. There has been a lot of work to reach out to various Indigenous organizations, such as the Inuit Public Health Task Group, the APTN Chiefs Committee on Health, the National Indigenous Vaccine Working Group, and the Urban Indigenous Vaccine Task Group. And there'll be further engagement through regional organizations, as well as reaching out to certain border communities as well, too. But some of the information, the feedback that's been received so far, and it's ensuring that is shared with FAC and IRCC, is that we want to ensure that the Indigenous communities have access to the same benefit as all other Canadians who want to be applying for these cards. So it shouldn't be reliant on having good internet connectivity or being able to go to a Service Canada office. There needs to be a means for all Canadians to have equal ability to apply for and obtain this information. Needs to ensure that if there's a proof of a co-identification, such as a driver's license, then items such as a status card should be allowed to be used as well, too. It's very important that people's mobility within Canada not be restricted, so that you still have the ability to travel to where you wish to travel to. But the point of the vaccine credential is that if there are certain requirements where you're traveling to, such as testing or isolation, you might be able to not have to go through the same requirements. It's also very important that any information collected as part of a vaccine credential, if stored at the federal level, adheres to OCAP, ownership, control, access, and possession principles. There need to be protections in place so the data isn't used for any other purposes without First Nations, Métis, or Inuit permission. It's also important that that people's travel rights, such as the Jay Treaty for Indigenous, for First Nations people of status, such crossing to the United States, are respected as part of the credentials. It's also very important that it's not ruled out in such a way that it brings up historical traumas like the days when a travel pass is required for an individual to leave their community. No one wants to see that kind of system in place ever again. Again, it is strictly a record of vaccination, a tool. How it will be used it remains to be determined. Now, you might have heard more recently, just yesterday, around the adjusting of Canada's border guidelines in regards to returning travelers. So we don't fully have an implemented proof of vaccine credential system yet, but what is happening is that for individuals who are returning to Canada, can use a new application called ArriveCan for uploading information that they might have received from their province or territory, basically their official paper record from their province. Then using that, if the information is uploaded into ArriveCan, does allow for certain requirements not have to be followed, such as the isolation in a government approved accommodation for 3 days. Might only be required to have a test upon entry instead of another test 8 days later. So again, it's not stopping people from traveling or from coming back into Canada who have a right or ability to leave Canada or to return to Canada. It just means that certain conditions upon return, such as isolation or quarantine, might be able to be waived for those who can prove they have their vaccination status. But that being said, it's important to remember that if one returns to Canada, and again, vaccines are not 100% perfect. If someone does come back to Canada and is showing symptoms of COVID, and the test result shows that they unfortunately did contract it, they will be required to do the quarantine and isolation requirements as per normal practice. But if the test shows negative and one has proof of vaccination, then the requirements are a little less onerous. So that's the background on vaccine credentials nationally. Now, I was asked to speak a little bit on cross-border vaccination. So what this has to do with is, people wondering, can I cross the border to get vaccinated in the United States? They seem to have lots of vaccines there. And I think the first thing that the Public Health Agency of Canada has asked us to convey and to remind all of us is that there are significant vaccine supplies in Canada now, and there's many more on the way. As of today, there's 37 million doses of vaccine in Canada, and there's many more millions scheduled on the way. 9 million more doses of Moderna being delivered in June. We have 2.4 million doses of Pfizer coming to Canada every week in June, and another 9.1 million doses coming into July. So it's really not necessary to travel across the border to get vaccinated. And at present, it's not really considered an essential medical need because so much vaccine is available in Canada. Now, there is an ability to cross the border for essential medical services under Canada's current border requirements. So, for example, if one lived in a border community and your only medical services were across the border, or if one was receiving cancer treatments, the Order in Council did allow for that kind of provision. In some rare instances, individuals were able to cross the border having a letter from their physician or a nurse or authorized medical professional saying that they require an essential medical service, in this case vaccination. We're able to obtain vaccine in the United States and then receive documentation in the United States saying that they received the essential medical service. And then for those individuals who presented back at the Canada border with this documentation, we're able to be exempted from the mandatory testing and isolation requirements. There are two First Nations which implemented some very successful and respectful cross-border vaccine clinics in partnership with their related nations in the United States, the Blackfoot Confederacy in Alberta and the Lower Kootenay Band. Now, they worked very closely with the Canada Border Services Agency, the respective First Nations in the United States worked closely with the U.S. Customs and Border Protection Service, just to ensure all guidelines were followed. And I think these were really positive examples of sharing and of generosity, and we're certainly, pleased that they went so well for them. But at present, with the advance of vaccine in Canada, it's really not necessary to go through that route. And since then, the United United States has implemented their perspective that given the amount of vaccine in Canada, they would not consider someone entering the US solely for the purpose of vaccination to be considered an essential service. So the other consideration in regards to cross-border vaccination is that in Canada's have what's called the Vaccine Injury Support Program. What that means is that in the very rare instance that someone has a serious and permanent side effect, there's a compensation program, basically an insurance program, to allow some compensation for the individual who had that very severe side effect. An individual who gets vaccinated in the United States or any other country is not eligible for this program. They would have to apply for the program that's within that respective country. So we are advising that, best to seek out the vaccination within Canada from the vaccines available. We know that it's people want to get vaccinated. So many people want to get vaccinated as soon as possible with their first and their second doses, and definitely that will happen. There will be enough vaccine in Canada by the end of July for all Canadians to receive 2 doses of vaccine. It just becomes a matter of having the ability to put vaccines in place in a timely fashion through vaccine services. And again, this is where the work of Indigenous organizations working in partnership with ISC or with the province or with other partners, both in community as well as in urban settings, is working so hard to make vaccine culturally safe, accessible, available, and we're really making great progress across the country. So I think that's all I have to say on the proof of vaccine credentials and cross-border vaccination. And again, just a generally great work overall. Certainly we'll welcome any questions that come in through the chat later on. I'm not a medical expert, but anything I don't know, I will relay on to the appropriate sources, and I'm sure through Marianne and her great team in FNHMA, we'll get the answers to the information you're looking for. So thank you very much for having me. I hope I haven't put anyone to sleep, and look forward to any questions or comments that come through. Thank you.
Mark, you unpacked so many topics in that time that you had, and we really appreciate it, especially folks that had lots of questions about passport implementations. How do we respect the J Treaty that is in place? And of course, what does it look like for status cards and not getting consent to leave our reserves to go get anything? We don't want to we've had enough trauma in the last couple of, enough. I think we can all agree to that. Mark, it's such a delight to see you again, and keep up the outstanding work. I am going to remind our folks that are watching and listening to the FNHMA Town Hall on COVID-19 that if you have a question, again, if you want to do that, thank you, like I just did to Auntie Judy, and now one to Doris Bear, Peguis First Nation, Certified First Nation Health Manager. Feel free to send a note in, FNHMA at ihtoday.ca. And on that note, I do want to say hello to some viewers who are chiming in on Facebook as well. Jerry, thank you for watching. Curtis, Yusuf, thank you as well. It's so important that we get this relevant. This is one for the blooper reel, Kim Mumford. Right? Like, I can't speak again today. We've just, we hit a peak and now we're on a downward trajectory of Marianne trying to enunciate words. We want to make sure that we keep providing reliable, credible information to everyone for the next week. Wow, I can't believe 49 episodes has gone by so fast. With that, I would like to call in our next guest. Very excited to hear what's happening at the Indigenous Primary Healthcare Council. Nikki, you ready to come on into the crow's nest and share what's happening? And I'd just like to say welcome, Nicole, and get you to unmute. Gonna get that t-shirt like everybody else. You're on mute. That's 2020, 2021. Come on in, Nikki.
Thanks so much, Marianne, and thank you for having me on your show today. It's an honor to be here. My name is Nikki Sengupta, as Marianne said, and I am the communications lead at the Indigenous Primary Healthcare Council. I work very closely with all areas of the IPHCC to help ensure that we're providing accurate and timely communications to all of our members and Indigenous peoples across Ontario. I am calling in today from Peterborough, Ontario, where I just moved from Toronto with my 2 sons. I'd like to start off today by telling you a bit about the IPHCC. We are a new Indigenous governed, culture-based, and Indigenous informed organization. Our key mandate is to support the advancement and evolution of Indigenous primary healthcare services, provision, and planning throughout Ontario. Our members currently include Aboriginal Health Access Centres, Aboriginal governed community health centres, and other Indigenous governed providers, and partnering Indigenous health researchers and scholars. Our network provides services to First Nations, Inuit, or Métis individuals living on and off reserve in urban, rural, and remote communities. This includes primary care delivery, as well as programming across the lifespan from prenatal to end of life in the areas of traditional healing, healthy lifestyles, mental health, and wellness, and more. I want to thank you again for the opportunity to share what we've been doing to support our member sites and Indigenous peoples during the pandemic. I'd like to highlight that during the pandemic, our sites remained open to our community members despite closures in other areas. Our primary role at that time was to ensure that people remained out of hospitals. This required a real coordinated response by many of our primary healthcare providers. Our frontline responded by opening testing and assessment centers, assisting with finding appropriate spaces for physical isolation when needed, and ensuring food security by preparing and dropping off care packages to families. At the beginning of the pandemic, IPHCC advocated to be part of provincial tables, such as the Bioethics and Children's Planning Tables for vaccine rollout and the Provincial Primary Care Action Table. In addition, we actively participated on the Indigenous-specific centralized COVID response table coordinated through the Ontario Ministry of Indigenous Affairs. As you may know, over 80% of the Indigenous population lives in urban settings across Ontario. Since the beginning of the pandemic, the IPHCC has collaborated with health agencies across the sector on advocacy efforts to ensure a consistent and inclusive approach was taken to support the Indigenous population. Everyone will probably remember at the beginning of the pandemic, there were very real concerns about PPE availability. The IPHCC also played a pivotal role in PPE distribution to member organizations. We were able to coordinate a bulk purchase of PPE from China, which included masks, gloves, and gowns in order to keep our member centers' doors open. Further, the IPHCC advocated at provincial tables to connect member organizations to the provincial, regional PPE supply chain for ongoing and sustainable PPE needs. By getting members PPE, they were able to keep their doors open, and it enabled them to take the overflow from hospitals and emergency rooms and keep patients in the community. Contact tracing and testing soon after became an urgent need. We've been working with member sites to identify contact tracing volunteers to work with local public health units and to make sure those volunteers are trained to provide Indigenous peoples with culturally safe support. We are currently developing a training module on cultural safety for mainstream contact tracers and are working with the Ministry of Health to implement this training across all contact tracers. In addition, IPHCC sought funding to purchase mobile units equipped to conduct COVID-19 testing and contact tracing, vaccine rollout, traditional healing, and to offer cultural supports. This allowed for real-time assessment and provision of patient-centered care. The mobile units will meet immediate needs and will also expand to meet future needs beyond the COVID response and will be vital during the recovery phases. All of our sites, especially in the beginning of the pandemic response, supported testing and assessment capacity for our communities by becoming full testing sites, sharing resources with existing sites, providing referrals and screening services, transportation for testing, facilitating in-home testing for those who are unable to access a center, and creating pop-up testing in First Nation communities when requested. In January, we broadened our attention to the good news that vaccines would begin rolling out in the late winter and spring. And in order to support the new vaccine clinics, we developed a toolkit and delivered training for frontline to set up and administer vaccines, so our sites were primed and ready once the vaccines were received. As of June 18th, 121,255 vaccines have been administered via our member sites, and that number continues to climb every day. I also just want to take a moment to note that Anishinaabe Health Toronto was the first site in Ontario to hold a youth vaccination clinic, which they held in partnership with the local First Nation school. To further support the vaccine rollout, IPHCC created several additional toolkits and held webinars for mainstream healthcare agencies, including 6 steps to effective engagement for vaccine distribution with Indigenous peoples. And this is a reference guide for mainstream organizations as they were beginning to look at vaccine planning. We also launched the Gashkiwadun toolkit and subsequent webinar. Gashkiwadun is an Ojibwe word that means able to take and carry it. This toolkit and webinar were designed to support Indigenous organizations with the planning and implementation of community-level COVID-19 vaccine clinics. Our latest activity has been working with Indigenous youth on an advocacy program. In the spring of this year, at the National Reconciliation Program at Save the Children Canada, approached the IPHCC to work on a youth vaccine advocacy campaign. The goals of this campaign were to increase knowledge and understanding of vaccines, build vaccine confidence, and reduce vaccine hesitancy. And this program was geared towards youth between the ages of 15 and 24 years old. To achieve this, we took a 3-phased approach. We started by holding an educational webinar for youth where we focused on a lot of myth busting. Following that, we did a digital storytelling process where the youth created short videos about their experiences during COVID-19, which they then shared on social media. After that, we moved into our community outreach and advocacy phase where the youth acted as ambassadors in their communities and took the information they had learned throughout the program to help combat vaccine hesitancy among their friends, family, and community members. It was important to us throughout the entire process that the youth were leading the direction, and they were the architects of this program. We wanted to ensure that their voices were heard, since so many of the decisions that are happening right now during the pandemic are being made by adults. So the youth helped inform all aspects from start to finish. Next steps for the program, we'll be launching a social media campaign with the videos the youth made in the coming days. There are 16 in total, and we're excited to share them and showcase the work we did. I even have a sneak peek for everyone, so I'd like to pass it over to the studio now and share one of the videos.
Since the pandemic, my life has changed in the way that I deal with my mental health. I'm a very social person who is happiest when I'm surrounded by my friends and my family. Being in isolation, though, I have had to find new ways to cope. I have started smudging, journaling, and I've had lots of time for self-reflection. While I am beginning a new journey, it is not without its challenges. I am getting a COVID vaccine because I do not want to struggle alone.
As you can see from the videos, each one is formatted the same. The youth told a story about how COVID has affected them, and they finished it with their reason for getting a vaccine. It was an incredible experience getting to work with these youth from across Ontario and Manitoba, and we built some great relationships. The youth feel that they developed their own community of support, and we got some incredible feedback from them, some saying that doing all of this in that group atmosphere gave them the confidence to speak and tell their stories by hearing from others that they were not alone in their experiences and how they were feeling throughout this. So with that, I'd just like to say thank you so much again, Marianne, for having me here today. To find out more about the IPHCC, you can visit our website at iphcc.ca, and make sure you follow us on social media so you don't miss any of the new videos from our youth as we release them over the next couple of weeks. You can find us on social at iphcc.ca, and all of our social media handles are also on our website.
I am stunned. Again, a crow, a loss for words in all of the amazing work your organization has unpacked. Nikki, don't go away yet. I just want to say, can you remind us how long you've been incorporated for at IPHCC?
The IPHCC was officially incorporated in November of 2019. We were around prior to that, but with the growing need for this type of advocacy work, we've expanded, and we're, as I said, officially incorporated in 2019, and we had our formal launch in February of 2020.
Wow, I am blown away by all of the amazing work you've been able to do in such a short time. And of course, Mark referred to it as well, the partnerships. Let's hold each other up. All of the borders coming down, our provincial and federal relationships, which are sometimes challenging to manage. It's like all of these barriers have really started to crumble, and seeing the partnership and the resiliency that is coming out of COVID are things I hope we can keep in whatever our new normal is. Congratulations, Nikki, on all of that outstanding work. And don't go away, because we will have a couple of more questions for you as well. So with that, I would like to thank all of you hardworking health leaders serving your nations, your organizations, and territories with this public service announcement. Over to the studio. To all the dedicated healthcare workers and providers on our community front lines, we thank you and owe you a debt of gratitude. We stand united as Indigenous health organizations. We support you all in your efforts. For credible information sources on COVID-19, please visit the Public Health Agency of Canada and Indigenous Services Canada websites. The partner organizations mentioned here are also trusted sources to support you. Thank you, and stay safe. Thank you to the studio for playing that message. It was, again, seeing all the partnerships and even unnatural partnerships coming together at the beginning of this really speaks to the value as Indigenous nations, specifically, of course, First Nation Health Managers Association, looking at First Nations specific, not at Inuit and Métis. So just, making sure that we're clear about the governance role at FNHMA, but seeing the partnerships coming out so that we could respond, keep each other safe, and not worry about what was happening coming down next, people deferring payments, getting funding out the door. And I can't wait to unpack the ride next week on Wednesday, June 30th, here on same time, same channel, however you're dialing in, listening to the radio. Continue to do that next week, where we're going to welcome back who we started with, Dr. Valerie Gideon at Indigenous Services Canada. We're going to talk about the peaks and the valleys, and goodness, there's been a lot, but join us as we reflect back to March of 2020 when we first started hearing about the news. We put together a town hall in a couple of short days here on ihtoday.ca, and a big kudos again to Don Barraclough and the team at Nation Talk, because Indigenous Health Today was born out of the pandemic as a response to getting information out there where you could search for reliable information. So join us as we unpack with Dr. Brenda Rastool, Dr. Carol Hopkins as well, and myself, and some of the First Nation Health Managers Association students who demonstrate resiliency in responding to a global pandemic and still continuing to take courses during all of this craziness going on around the globe. So you want to be able to tune in for that. And we're going to do a quick reflection. If you haven't had the opportunity yet, take a look at the day of celebration that FNHMA hosted. We had all of the political party representatives talking and thanking frontline health workers, the Prime Minister, more importantly, all of the Indigenous leaders as well, who were very grateful in terms of supporting nations and all of the health human resources that it takes to fight something like this. We even had Carrie Price on. So lots of musical entertainment. My girl, Buffy St. Marie, she was on as well. She is another Pie Pop princess. Well, she's a warrior, but I digress. How about we go to the inbox, but keep that date circled next Wednesday. We definitely want you tuning in for the last town hall. So a couple of questions. Nikki, I'm going to get you to come back into the crow's nest because I know youth, having that message out about vaccine confidence from a youth perspective is so vital during these times, especially given that some of the youth aren't even eligible for, weren't eligible for vaccines yet. Now, different story. How did you find these folks? Who did you partner with to get these out? And I'm just delighted to see these emerging, well, they are leaders, but what's in store for them for the next 7 generations and tomorrow's? Tell us about that, Nikki, and can we download them? Can we share them with our nations?
Absolutely. All of the videos are posted on the IPHCC YouTube channel, so you can find them all there. As I mentioned, we're also sharing them regularly on all of our social media channels. As I mentioned earlier, we partnered on this initiative with the National Reconciliation Program at Save the Children Canada, who are an incredible team of people. They approached us with this project, and we both agreed that it had to be youth-led at all stages. So we went to social media to find participants, as that's the best place to find youth these days. And without being able to go into community and speak in person with folks, that's the approach we took, and we had a really, really great response and a great group of youth who participated in this program.
Oh, I'm just awestruck, Nikki, at how much work you were able to do and to get those resources out, and even the toolkit for some of the Aboriginal health access centers as well, in terms of providing those needles in arms in a culturally safe and relevant way. That's spectacular. I'm going to transition now over to Mark. Mark, come into the crow's nest. We were just chatting about some of the youth innovation with Nikki there. What are some of the other innovations that you're seeing when you sit at those tables? Are you hearing anything that just really made you go, wow, from your own perspective, Mark?
Oh, absolutely. From across the country. I think the real strength of the Indigenous vaccine rollout hasn't been about mass production, again, as many needles in his arm as soon as possible, as fast as possible. And not that there's anything wrong with that, but I think we need to recognize, and it has been recognized, that for some individuals, approaching a big mass vaccination center or a hospital carries with it concerns about, will I be welcomed? Will I feel safe? Do I fit in? And while again, many individuals were quite comfortable doing that, not everyone is. There are definitely some historical traumas. There has been racism in healthcare. So the work that's been done to reach out to people to bring vaccines to where they are in places that are safe. The National Association of Friendship Centers has done some amazing work with a number of communities to have vaccination in friendship centers. We have the Métis Nation of Alberta, which has just done some amazing work hosting clinics in Edmonton for First Nations, Inuit, and Métis, and also non-Indigenous people as well. Just a real sense of partnerships and working together. Métis Nation of Saskatchewan, they're calling individual people on the list saying, hey, we're inviting you to come and get vaccinated. It's important. We care about you. Toronto had a vaccine powwow on Saturday, with a few hundred people vaccinated. Just from coast to coast, reaching out to individuals who are homeless, bringing vaccines to them through mobile clinics, or partnering with an Indigenous organization so it's someone who they trust and have a relationship with. So maybe they're not so scared of getting a vaccine. So many different ways of realizing that it might take more work, but it's just as valuable for everyone to be vaccinated. I mean, not just the ones where it's easy and they'll come to the mass vaccination center, but for those who I think have some real valid concerns and just want to have the information and get the trusted information. And when we hear from the elders or the chief who gets vaccinated first on social media, just to kind of show, I'm willing to do this. I'm an example for my people. It's just amazing the work that takes place. And really, no one is saying 70% is good enough, 75% is good enough. People are saying, no, we need to make sure we've reached out and made it possible for everyone who wants a vaccine to receive one. We have to really look at those barriers. And it's really Indigenous, I think, who have actually created a number of spaces where people are much more safer going to those. I mean, there's examples from every city across the country. And sometimes, talking about these mass vaccination centers, some great partnership between local public health organizations, welcoming Indigenous nurses to be part of those, or setting aside an Indigenous space, having Indigenous ambassadors, translators. We have to realize there's got to be many paths so people can choose the path that works best for them. And it's certainly in a way that I didn't see happen during H1N1 in 2009. And things really are different now. They're still not as good as they need to be, but I think definitely a lot of good thoughts and good efforts going on. And as I said, I get to be a witness to this, a chance to help in my small way, but just really awestruck and again, a pleasure to be part of this.
Well, don't go away yet, Mark. I am with you on that. I am just awestruck at the power of resiliency demonstrated across Turtle Island and ensuring we're getting needles in arms in a safe way that's culturally respected and meeting people where they are and wanting to get their vaccines. So, Mark, you talked about being in e-health before, digital services, digital e-health. I have that passion still of e-health being near and dear to my heart. And right away, I looked for digital health during COVID-19. We are seeing videos. We're seeing a lot of information obviously being shared in different types of mediums now. Were there any other digital services that really stood out for you during the deployment of COVID-19 resources? Anything there that you want to touch upon, Mark?
Oh, sure. Happy to, Marion. There's been so much great work in digital health or e-health across the country, even before COVID. Use of telehealth technologies, allowing people to see a doctor or a specialist, psychiatrist from where they live, rather than having to travel by plane or by bus, by car for hours. For sometimes it was a very short appointment, and these were already in place. Ontario had a virtual emergency medical services program that they would link into to Orange and to hospitals. Manitoba was having over 6,000 clinical sessions a year from all across the province. BC, Alberta, so many provinces already had digital health technology in place. And so if you recall, when COVID happened early on, a number of communities chose to lock down to maintain their border safety. A number of individuals were still able to receive their medical care. A huge advantage right now that nearly every province and territory has some kind of electronic digital immunization registry. Much better for keeping track of who's been vaccinated, for reminders, for tracking progress. And many Indigenous communities are part of these provincial systems, so that no matter where the person gets vaccinated, there's a record of it. So that will really be important for, again, keeping track of who has received vaccines, when they receive them, what kind of vaccine, tracking shipments, and possibly also feeding into the proof of vaccination credentials that we talked about, that now we don't have scattered immunization records in doctors' offices or clinics or hospitals across the country. They're much better registries now than there were back in 2009. So I think that's a huge part of the strength of e-health and digital health.
Thank you so much for answering that question, Mark. I really appreciated too your incorporation when you talked earlier about respecting the OCAP principles. And obviously that's something top of mind for everybody when we talk about digital health. So again, for anyone wanting to learn a little bit more about OCAP principles, make sure to check out the First Nation Information Governance Center as well. I'm coming back to you, Nikki. Come on back into the crow's nest. Tell me a little bit about the mobile units that have been deployed and about some of the bulk purchasing to coordinate those efforts and get those prices down so that you could have larger purchasing power as well. Share a little bit more about that, if you don't mind, Nicole.
Sure. Yeah. So the PPE ordering it happened very quickly at the beginning, and we had to coordinate and do a lot of data gathering and needs requirements with all of our members across the province. As I mentioned earlier, we did end up doing a bulk order from China. But of course, with timelines and shipping delays, we had to get a little bit creative in how we were going to get that to our members in the most cost-effective way and as quickly as possible. So we got a bit creative in how we had things shipped and split up our orders so that we could have some shipped on a plane, some shipped on a boat. Bringing the price down and making sure that it was affordable and cost effective for all of our members, but at the same time, they would get things in their hands as soon as possible so that they could stay open. We also partnered with a couple local delivery companies who weren't necessarily in the delivery business, but because of COVID and their regular day-to-day business wasn't running, they were able to help us out and support us there with our needs.
Oh, thank you so much for reminding us about what those early days look like, trying to scramble to get PPE in place and make sure we were trying to don our masks properly. I was just reminded about where we were back in March and April earlier this year. And on that note, I do want to give a shout out to First Nation Procurement Incorporated. Just got a note from Matthew. Matthew, thanks again for making the large donation that you did with respect to getting PPE into our nation's hands without having to go around, the formulas that were being asked and that donation, millions of masks were donated to Manitoba with the help of First Nation Procurement Incorporated. So if you're still looking for PPE, they now have new technologies where you don't even need the health human resources to check temperatures. They have screening equipment. I'm not getting any kickbacks from this company. I just saw the information come up. So I just wanted to share another Indigenous business that you could look to for your continued PPE supplies. So I do have another comment that I want to add. So there's a note in here saying a special thanks, and this will be a little bit of an inside joke, but a special thanks to Ed Roy, Mr. Keith Kahn, little Lisa Miller, Miller Time, and Paul, all working in the government, Indigenous and non-Indigenous, keeping us safe. Very much look forward to getting out post-pandemic for some golf, and that the winnings that go with it, non-monetary for those lawyers out there, from Dawn at Peguis First Nation. So a little bit of laughter back into the program about getting out and doing some golf. So I really do want to get to a couple of more thank yous as well and information. This time just goes by. I say it every single show. It goes by like that. And before you know it, we're at the end of our hour. First and foremost, I really want to say thanks, Nicole. Thank you, Mark, for coming on and sharing that amazing information about where we're at with passports, what you have been doing at the Indigenous Primary Healthcare Council. Just a lot of appreciation. We also want to thank our partners at Inuit Telecom for providing the translation into French as well, so that we're getting even more people informed in the language of their choice. And of course, we can't do this without a whole team of people supporting us. Jason, Chris, Anthony, Dawn, Stella, the whole FNHMA family. Thank you so very much. And I also want to thank some of our Indigenous media partners as well. Those live Facebook media partners are here to broadcast, and those are Micmac Maliseed Native News, The Wolf 95.7 in Fredericton, Nation News in Montreal. Of course, FNHMA Facebook is also another place to find this information. Element FM in Toronto and in Ottawa as well. Anishinaabeg Nation in North Bay. Wawate News in the Sioux. Thank you very much. And I think I finally said it right. It took 48 shows, but getting it. Of course, NCIFM. Davy, your auntie is saying hello. I'll see you tomorrow morning on the air in Manitoba. APTN News, MBC Radio in Larange, Eagle Feather News, Alberta Native News, CJWE in Calgary, CFWE in Edmonton, CKLB in Yellowknife, Co-op Radio in Vancouver, the First Nations Drum also in Vancouver, CFNR in Terrence, BC, and Hashlitsa newspaper in British Columbia as well. You can also check out rebroadcasts on the radio. So check into one of those Indigenous media partners to see when you can hear this again. And don't forget, yay, APTN. Thank you so much for showing us on Saturdays. Until next week, stay safe, stay healthy. Hi, hi.